bit more of a sort of idea of what everybody is up to. Thank you for starting that recording, Liana. I always think it in my head and never do it. Also, we are going to be doing some regional boot camps again, which is very exciting. I think the last time we did it was in 2021, but we're going to do some again next year in February and March, which is great. So we are still just finalising those details. We've just set the sort of rough dates. So I will be having sort of a chat with everybody sort of in the areas that we're looking to go to about venues, details, and that type of stuff. So, but just wanted to let you guys know that they are coming again and what months they're in. So just watch this space. We will be in touch with that, which is good. And then also just a webinar that I got brought my attention to on LinkedIn from PMANS. They're running a webinar on the 15th of November. It's a Q&A session on CPD points, which I think will be quite useful for the PHOs and the practices, obviously. Now, I will put a link in the chat, sort of once I've finished talking about it, but I can also email it out to everyone. I just thought that would be really useful because they do put out quite a bit of like great content, but sometimes it just gets missed in that, thousands of LinkedIn posts. So just wanted to bring that up to everybody. So those are my sort of 3 quick ones there. We do have another Leads meeting next month, which I'm pretty sure is already in your calendars, and I'm just finalising my speakers for that. So I will send the agenda out a bit earlier so everybody can kind of see what's going to be going on in that. But that is me. So I will pass on to Jazz.
Thanks, Petrea. Now, with the thing with Amajit is, she sent quite a long email, so I'll try to keep it brief. Petrea's covered off a couple of the points, so just wanted to share with everybody some of the highlights from our board and just some other general points about our mahi for you to be aware of, I guess. So firstly, the model of care is really, the review of the healthcare model of care is really high up on our list of priorities, and we're working with other agencies to progress this, and we will be seeking your input for this to really kind of help us shape what it looks like going forward. So there will be a working group and we'll be drafting some terms of reference for that group. And so we'll just watch this space. There'll be some emails and some comms coming out to the network. The other point, our board has agreed to progress a new legal structure for collaborative. So this is well underway. So this will mean a lot of change, but does formalise us as a separate legal entity. So we become an incorporated society. But it won't change the work that we're doing. It may mean that we get to do more work. So in other spaces. So that'd be cool. The other, I guess, main thing to really mention is that the board really reiterated to us about the pressure and the burden and the stress and all the challenges that you will all be familiar with that are on general practice, and the kind of the workforce challenges and just post-COVID and just the general kind of workforce stuff and pressure stuff on services, and with increasing demand and complexity of patient need as well. So we're well aware of that. And so, as Petrea mentioned, that those boot camps, and also kind of thinking about working with you guys to support general practice. We're here to help. And so one of the things we will be doing is we'll be circulating a survey to really hear from you about what more you need. So while we've kind of got our standard stuff that we have, our resources, and our, as well as individuals, as well as Petrea coming out to support you. If there's anything more you think of, please let us know. So we will send a survey, but if you have any other ideas, please reach out to Petrea, myself, or even Liana, and just kind of ask, because we are here to help you. Couple of other trainings that I just wanted to mention. There is that facilitating change workshop, your identity as a facilitator, and I know a few people have signed up, a few people have done it previously. That's on the 23rd of November. There is information on our website. So we've got a couple of places still left. If there are people in your teams, your networks, please let them know. And I know that people that have done it have found it really beneficial. And the other one I just wanted to mention is this week we went up to Wanganui, and when I say we, me and Jehan Castaneda, who has been doing workshops around leading with stories. So it's 4-hour workshop that's focused on leaders and really kind of empowering them to really kind of leading with their own stories and also elevating the stories of the people they work with. So Renee and Joe, I'm sure you give a thumbs up to those workshops. So we have kind of done the Wellington region, and we you know, Wanganui was our step out of the Wellington region, and I know a few others have kind of approached us, but they are amazing workshops. Renee or Joe, I don't know if you want to give some feedback, share with others how you found it.
I found it really good because I'm actually going to the Integrated Care Conference over in Sydney in about 3 weeks, and much to my disgust, I'm actually speaking. So I know I'm not a public speaker myself, but that's right, I'll have Jude by my side, and Whitirangi. But actually it was really good because the last exercise in that was just perfect for me to be able to write my story for my piece of the conference. So it was so valuable. Yeah, just really made us think, I guess for some people, step a little bit outside their comfort zone a little bit, because there was 2 introverts sitting at my table. It was really interesting. And they're both colleagues, and I do know that they are like that, and I'm like, you know, but they did, yeah, it was very good. Well worth it.
Yes, once again, got to support Joe and that whole kaupapa, because I also thought it was really interesting that we are now starting to speak about our stories in our team meetings, which is a big step for all of us, and we're now calling it amplifying our stories together as a team, because we've been doing a lot of reshuffling at the network with a lot of things, structure, how we're going to be working together. That was the best team involvement out of the whole network, that we all got together and be able to express our stories and not be afraid to express it, and really speak with confidence around our stories and what we actually do, because I never knew different people, different roles here at the network did different things, and sometimes I just thought all of them were all just clinical. So it did feel really interesting, like, oh, I didn't know you do that, and how we're taken on a journey, but we were able to be taken on the journey through the structure of Jihan's workshop and really make the outcomes like, oh, wow, that sounds really good at the end. What do you reckon, Joe? Yeah.
Totally agree. Sorry.
Yeah.
Yeah.
Thanks so much. And just the feedback I'd give from CoLab's perspective, that was the largest group that we had. So there were 40 people that the network invited. So, and I think just over half of them were from within the network, within the PHO, but there was 50% of the people who were from kaupapa, Māori services, from other community organisations. So it gave a really good signal to us that this network is really wanting to connect with the community. And so, as Renee said, you know, people were sitting next to people that they'd worked or heard about and didn't know very much about. So, you know, and a lot of it is about, you know, starts with self, and even the facilitating change. A lot of, you know, when we're trying to kind of you know, support change, we have to think about those words that Jehan says. It's like, why should you care what I care about? So it's about telling your story to be able to say it in a way to engage others. So yeah, thank you for that feedback. And yep, so if anyone wants to know more, please just reach out to me and I can send you some details about those. So Jehan is heading overseas next year, so his time is becoming limited. So we are wanting to book him in to come back and do some of those. So cool. And just a couple of other things. The other feedback to give you, well, to share with you, is that we have had amazing feedback following our conference, and we're just creating a feedback report which we will be sharing with you. But we were really blown away at the response level and how everyone came away feeling so inspired to action and reflected on their own contribution to support whānau that they're serving. So yeah, so that was really cool. And finally, just to give people a heads up about some staff changes. So we have got some new staff that will be joining our team, and a couple of them will be familiar to you. One is Nee Brunenberg, who is from Tawara Health and has been a healthcare home kind of facilitator. She'll be joining our team in November, at the end of November, and we'll also be welcoming Coral Fitzgerald, who is from the Canterbury Clinical Network, who'll be joining us too. So both of them will be just supporting across all our work programs. So we're looking forward to adding them to our offerings to you guys too. And Chantel will just be moving into a slightly different capacity with the team, where she'll be doing some specific focus pieces of work for us. So so we'll still have her on board with us. So yeah, that's me. So if anyone's got any questions or anything, feel free to add it in the chat or email me. But yeah, I'll pass back to Petrea. But thank you.
Thank you, Jazz. Always good to get a bit of an update of what's happening for everybody. So exciting to have Nee and Coral. I looked at the name and I was like, Carol? Coming along, yeah, it's very exciting to have new people joining the team. But should we move into the engagement hub? And that is our lovely Liana.
Thank you. What an introduction. Engagement hub. So a lot of you might remember we had a brief chat earlier in the year, I think it was in March, about the engagement hub, and we had a quick wee look at it. So through a combination of staff changes, an extremely busy year where our resources were committed elsewhere, this project has stalled. So apologies for that. We feel like we're on top of it now. We're ready to start using it and introduce it to our lovely leads group. So really appreciate those who can make it. Again, this is being recorded, so for those that can't get along, you can watch it later, or you can always get in touch with me anyway for more info. The whole reason behind this is to get the resources for our members only off the website into an area where you guys can access it. At the moment, most of our resources are on the website where it's totally public. So we want to acknowledge our members and that you need a place to go to get that kind of stuff. You can network with each other. I know, even from us, the inboxes sort of get full with messages. This is where you can come on, network with each other, chat with us, ask questions, and it's not going to fill up your inbox back and forth all the time. So want to be a bit more leaner in that department. So I'm just going to show you a little bit about the login. After this call, you'll all get an email, which will be an invitation to register for the engagement hub. So I just want to show you what that will look like. I'm no expert, so please bear with me. But if you have questions, I'll find out. So definitely, there's no silly questions. I just wanted to show, first of all, I did a little bit of just a screen grab from when I first logged in, because of course, because I'm admin access, it won't look the same for you. So I'll just share my screen onto a couple of PowerPoints first of all. And if there's any questions along the way, please just sing out. Petrea, maybe if you could keep an eye on the chats, because I can't see it once I'm in here. So I'll just share my screen and make sure you can see the right thing. Hopefully I can see you, Petrea. Yay. Okay, so this is the screen that you'll see when you first get the email from us to invite you along to our engagement hub. So you'll see up in the top right, there's just a register box. So you just click on that. This is the screen that will come up once you've entered your details. So it's pretty standard, just fill in your details, email address. You'll get this little message here just to say that your account's been created and that you need to verify it. So it'll send you an automatic email. Just follow that link. So it's pretty standard to any other way that you'd normally sign up for anything. Hopefully this is going to go to the next one. Yeah. So up the top here, so this is what I received after I had registered, that your account's been created. So you just need to click on this link. I know that a lot of you, especially PHO email addresses, have got the firewalls that might prevent some of this stuff coming through. So just have a wee check of your spam folder. I got this email within about a minute. So if you haven't got it within a minute, just let me know and I can have a wee look for it for you. So you just need to click there to verify, and then next time you log in, your screen will look like this one. And you'll see straight on the front page there is the Leads Hub. So you are more than welcome just to click on the Leads Hub and go straight in, or see at the top here the wee yellow bit that I've highlighted. If you click on that piece, it will go to a screen that looks like this. So again, obviously on the team, but this is where you can change your passwords, update your preferences, lots of tick boxes. You can put a profile picture in there if you want. All of that kind of thing. So just to show you what that would look like, but you're welcome to go straight into here and it will take you to our Leads Hub. So I'm just going to stop sharing that for a second so I can jump into, if I can find where you are now. There we go. And I'll just jump back into the other screen. Does anyone have any questions about signing up so far? No, it's all, I mean, again, you know where I am. So if you're having any troubles, you can just come find me.
Actually, I did have a question. So
Yes.
say, you know, like the lead is joining and then they want, you know, another person in their healthcare home, you know, change facilitation team to join. Do they have to contact us to join?
No. So the emails that I send out are just a way to encourage to join, but you can just go to the same link and just click register and you can get in that way. So that's fine. I'll just show you what it looks like once you jump in. Sorry, I've got so many screens open. I just need to find where I'm at now. Here we go. So hopefully everybody can see two lovely wahine on the front screen. Right. So again, if anyone's got any questions, just stop me or Patria will flag me because I can't see you now. So this is what our Leads Engagement Hub looks like. So I'll just quickly run through. When you guys log in, because I'm an admin, it doesn't show up, but there'll just be a little button under here, under this back area that says follow project. So this is where you can click, and it just means that each time we update something, you'll just get a wee email to say agenda's been uploaded, link is here. Can I just suggest in the meantime not to click that button just yet, because I'm still loading so much stuff on here. You'll get an email every 5 seconds, which will be extremely annoying. So just perhaps I'll send out a little email to all of you saying, hey, follow the project now, I'm finished putting everything on it, just so that you don't get so many. So basically, this is what we've got for now. So some of the things that I've loaded up on here are examples to show you. So I'll start from the top and just, again, stop me if you've got any questions. So this is just a wee bit about the Leads group, and there's a wee video there about the model of care. Over here, I think it's probably the area you'll use a lot, which is meetings and workshops. So I've loaded some up here already. Again, these will just keep being loaded up when we get the new dates. One feature I wanted to show you is if you were to click on the event, so this is for today's event, for example, it will open up more information about the event. And if you click on the view and register button, it gives you all of the info and also the Teams link again. So if for some reason you're thinking, I've lost that email, this will be really useful as well for our in-person Leads meetings. You'll be able to click, you can click here whether you're attending. If you were to click yes or yes that you're attending, it will ask you some questions about your dietary requirements so that we'll know for providing lunch and all that kind of thing. So obviously, because this is online, we don't need any of these maps, but also we'll show you where it is, what time you have to be there, etc. So I mean, it's pretty standard, laid out like a standard website with, you know, if you go into something, you can click back. All of our news and updates are in here. I've popped our newsletter in there. This was a little example that we already had in there. So again, just a bit of a filler to show you what it does. Also on the right here, we've got all of the agendas and presentations. So for our peer sessions and our Leads meetings, these will all be in here. I just did want to show you, for example, that if we have a peer session or a leads meeting where the presentation or some slides or documents have been provided, that, for example, in January, we had this one where Astuti supplied us with her presentation and some other interesting bits and pieces. So we'll pop them all in there as well. So if someone misses a peer session, the slides and documents, if provided, will be in here. So moving down to, there's a poll. Again, I've just put an example question in there, but it'd be really good to get your feedback. If the Tuesdays is a good day for the peer session, we might choose some different questions to put in there occasionally. Again, this is for you guys, so your feedback is really appreciated. This, I think, will be really, really interesting for us going forward, is the open chat wall. So we can chat back and forth with each other, asking questions, and it will all appear up here. So for example, you just need to click on view all comments and it will go into a larger screen. But I just wanted to let everyone know that I have taken the moderator option off this. So nobody's going to actually see this before it's up there live for everybody else to see. So I know we're a small group and we all know each other and that everyone will be kind, but just be aware that once it goes up there, you need to contact me to take it down. You can't delete it yourself. So just be aware of any comments that you're putting up there. But it's good for us to be able to chat back and forward. So I've just put an example one in there. Does anyone know how to register for facilitating change? And then you can just really simply put an answer in there, which I'm sure won't work because I'm showing you live. There we go. So, and then it answers it. You can like it. Of course, once this gets more and more populated with people going back and forward, you can actually click the little green like button on something and it will follow that particular question so that you don't see everything all at once, and that'll show up in your preferences. So another really cool feature. There we go. So that's on your main screen there. We've got some frequently asked questions here. So again, this is your feedback. So if you want something else to appear here, or if I find I'm getting a similar question from a few people, then I'll pop them in here. So hard copies of the model of care, for example, or when we're catching up, how often are the meetings, that info's in there. And I know lots of people ask about this. All of the peer session recordings are in here as well. So providing that we've had permission to record and that everybody's okay with it, then they'll be loaded up to our YouTube channel and they'll be in here. I guess this is a really good time to mention as well. We had a peer session in September where lots of people asked for the recording, and I sent a wee email out to it because it was really private stuff that we didn't want, you know, sent out all over the place. But again, because this hub is just for our members, this is a really good spot for it. So we know that if we pop it up on here, that it's just for you, you PHOs and you members, and it doesn't go any further. So that's cool. Down the bottom, we've got some a discussion topic. So again, this is just an example one that's been in here. How can we better improve telehealth experience for professionals? You might have nothing's in there at the moment. You might have some ideas or a piece of work in particular that you're doing in your PHO that you just want an opinion or some ideas of what other people are doing. So you could email me and say, hey, can this be the discussion topic this month? And I can pop it up there for you. We can have as many questions in there as you like. And some important websites and feedback down the bottom. So this just comes to our admin privately. Again, you all know my email, so if you prefer, you can just send me an email directly. It is probably good to pop it in here so that if I'm away, somebody else will be checking it. So is there any questions on any of that? Sorry, I probably ran through it really quickly.
I think it looks amazing, and having those peer sessions there is so good. Because I have noticed myself, like you go into the sort of the collab YouTube, like if I'm going to direct somebody else to it, and like there's so much stuff in there that you sort of like, oh, which one do I want? So I think that's so good having that there. Was there other areas, you know, sort of like on the front page?
On the home page?
Yeah.
So at the moment, if you're invited into a project, there's just this project page. So obviously there's a lot. There'll be resource library, all of these tabs down here will be where the resources are that are currently on the website. So we do still have a lot more to add in there, but this will be the main spot that you come to each time. Yeah.
Excellent.
Yeah.
Is there anything that anyone on the group today sort of thinks is missing or that they would like to see? Because, there's always so much you can do on a website that until you actually go and look for it, may or may not be there. So we're definitely open to sort of feedback on what areas we think would be quite good. Because I know this has come up a few times sort of since it originally got mentioned, would be quite good for that chat forum and being able to ask questions directly of the leads without sending emails, which I think is great.
And just, I was even thinking before, Petrea, the stuff that you've put in the chat about the PMANS link as well that you were talking about, Lovey, is this this chat function that we were looking at before. When you come down here, you can just click, you can add a picture, or there's a little button as well, which I've just temporarily lost just here, and you can add a link. So if something's really interesting, I mean, you can put anything in there, a document, something that you want us to have a look at or share that you think might be interesting. So that's a really good spot to put that stuff as well.
Amazing. I'll put that link in. Yeah, what were you saying, Lovey?
Sorry. I guess, I've just made a couple of comments, but I think just that whole idea of being able to share and chat and, because we don't have enough of that, I don't think, because, sometimes we have questions come up and, you just want to get the answer. And so sometimes even just jumping onto, this type of platform to kind of reach out and get some answers or support, or this is how we did it. I mean, that would be great. I guess the risk in some of it can often be is around our behaviours, and yes, we're all mature, all of that kind of stuff. So I guess that guidance around being respectful in our communication, and because sometimes again stuff can get lost in translation when we're emailing, or it's not that kind of kanohi ki te kanohi. So I mean look, I mean, we could say it that that it wasn't meant to sound that way, but I guess if we front foot it and say being mindful about the way that we communicate, because the risk is you don't want to whakaiti someone, so kind of put them down, when in fact actually it is about a mana enhancing way to kind of provide information. So because the worst thing you want to do is that then people just become silent and then they don't use it as an actual tool, because then they're scared that someone might jump in and kind of, yes, it's social media, right? It's the cesspool of stuff, but in this, we're all like-minded. So I mean, so just the idea around that kind of behaviours that we have when we are communicating with one another. I'm all up for sharing that information if we can, lean into something that someone's already, made a mistake on, and this is how they got it better. It's like, oh yeah, I won't do it that way. I thought that was the best way to do it, but in fact, actually, I was worried about that. I didn't know that. So it would be really great to have some really good ideas around there. So thank you. I mean, that all looks so good and easy to follow. Just so easy to follow.
I think once you get in there and have a play around, it will be easy to follow. But yeah, absolutely agree with your feedback, Lovey, that when we write things, it is always up for interpretation. So actually, when you log into the hub, I didn't mention that the first page that comes up is a little bit about our values and our expectations of the conduct of what will be happening on here. So I missed that step. But yeah, I think as long as we apply the same, respect that goes with our leads meetings, and hopefully we don't have to turn that moderator button on. Yeah, totally understand what you mean.
I think it'll be quite good to also share, perhaps if there's areas that you're struggling in, connecting with your practices, maybe on certain parts. I think this is a really good space to do that, because sort of, all of the leads are doing, a form of the same communication with your practices about this model of care. So I just think it's really going to open up quite a bit of, sharing, relationship building, and just connecting with other people, you know, kind of trying to work in the same space, which I think will be really great.
And also, if there's something that you think, oh, actually, it would be really helpful if that was there. This actual platform, this is just a tiny part of what it actually does. So just ask. There's no silly question, because it can look completely different. If you think, oh, that's perhaps not laid out properly, I'm having to scroll right down to the bottom to get really useful information all the time, please just let me know, because everything's changeable, and yeah, there are some really cool tools in the background. So you'll see this change occasionally as we come across stuff that's really interesting or really helpful. But again, it's your page, so if you keep that feedback coming, that would be really helpful.
I do have a question. When you join, can you see who else is, like if I'm commenting, can I see who has access to see that? Like who are the other members that are currently part of that project?
No, so you can't. I think I can in the background, but you can't. I guess you have to presume that all of the leads are on here. But you'll be able to see if they reply to a comment, or if you put something up, somebody likes it or someone uses it, then you'll be able to see that, but you can't see who's just generally on it at the time. Yeah.
Cool.
But yeah, you have to presume all the leads are on it. Yeah.
Yeah. And my other question was, you know how if you follow it, we get a notification when something gets added. Is that include if somebody puts a comment on that discussion page? And
yeah,
if there's a
so
response?
specifically if it's your comment, so if you've put the question up there, you will get a response saying somebody's replied to your question. If you're not part of that conversation, you won't get every single reply. Again, in that dashboard at the start, you can click buttons that make it really, really detailed or really vague. So have a play around with it. You might think, oh my God, I'm turning that off. I've had too many emails. But yeah, have a wee play around with that. I know that you can specifically tick certain boxes, so you might not really need to know when somebody has put a comment up, but you might really want to know when I load the agenda. So you can tick the agenda box and you'll only be notified for that part. So it's quite user-friendly in that way. Yeah.
That's good. Yeah, because I guess if we're trying to make it sort of an open discussion area, getting that notification when somebody does put a question up on the discussion, I think maybe we'll have a bit of a dig into that, Liana.
Yeah.
So we know those options, everybody can ask us as well.
Yeah, and it's also worth mentioning as well that obviously for the next few months we'll still be sending out the emails to let you know about the leads meetings. You'll still get the links in your calendar. It is worth knowing that when you accept a meeting in the meetings and workshop area, it will automatically send you a calendar invite to your Outlook. So eventually you might decide that that's the way you want to do it, but we'll be doing both for a while. So don't think that you have to rush and figure out how to use it. Yeah.
Amazing. Renee.
Renee.
Sorry if I missed this earlier, but with access to this engagement hub, is it just one, like the actual lead? I mean, are there some PHOs that have teams actually involved in the healthcare home role? Like, what are we looking at here?
Yeah, so Petrea did ask that question before as well. So if you have got certain, some PHOs have one lead, or some PHOs have a team that you want to be able to access this kind of thing. So I just realized I'm not sharing my screen anymore, so I'm pointing at things that you can't see. But you can just go to the website and click register, so they can register as well. I mean, you're welcome to share, like you might log in as your PHO and all of you can share that password, but it's just that when you comment or ask a question, it will show up as the whole team. So if you want individual ones, you can do that. Yeah. Cool.
Amazing.
Can I just add a comment? It's awesome. I think that this could probably really change a lot of things for us and just speed up communication, and any frustrations that people might sometimes have. It's like, where's that link? Where's that email that Liana sent? It's like you've got it all in one place. But what I'm excited about this is the opportunity for us to design our support to you going forward. So you might post up a question about a particular issue that you're finding on a couple of your practices, And then, you know, you just post that, is anyone else having this issue? And then always this, or it might be something about shared medical appointments, you know, then others can start feeding into it. But then if we notice, hey, look, this is coming up quite a bit, we could do a focused peer learning session on it. You know, it's kind of enables us to kind of, rather than you all being individually being targeted by Patria, it's one place where we can get all that information. The other thing is that I'm excited about is it's a place for you also to showcase the amazing work that you guys are doing, or your practices are doing, so, or people in your community are doing. So if you kind of have a story, Renee, from one of your team meetings, like, oh, I really want to share that with others, post it on here, and then, you know, we can kind of profile it, put a spotlight on in our newsletter, and share it with the community. So you know, and it might be that, you know, you've got a story and then somebody else might have a similar story, and we were like, so hey, look, let's share this with the community so others can learn and be inspired. So that part of it, I think, is really exciting. So yeah, so it's not just for the issues, it's also for the celebrations as well, and really kind of, yeah, celebrating the amazing work that is happening out there that we all know about, but we need to share with others. So yeah, cool.
Awesome. Yeah, I think that is probably all I had to show you at the moment. But yeah, feel free, you'll get an email to register. Feel free to email me if you've got any questions, or if you're having trouble getting into it. I will be loading a lot more resource on it though over the next coming weeks. So just don't click that follow project yet, because it's probably going to be really annoying.
You know, if for some reason you don't feel like you're getting enough emails, I mean, get in there. But pretty sure that's
also
not
for
a problem
those,
we have.
yeah, for those that couldn't make it, because I know that there are some leads that have asked about this that couldn't make it onto the call. Tisha, you might be able to pass on to Lawrence that you're welcome just to flick me an email, and I can do another a little Teams with a few other people and just show them through it. It is pretty much point and click, but it is sometimes easier just to ask questions online. So yeah, feel free to get in touch.
Excellent. And it didn't take too long, which is always nice. You know, when you kind of get a recording to watch back that, and you know that you sort of need a certain point of it, but you're like, oh, I have to watch 3 hours to get that bit I wanted, but not hours. Efficient. No. You know, we're lean. We are working lean. Cool. Well, does anybody have anything they want to bring up just while we're here? We've got a bit of extra time, or perhaps about, you know, any of the things that we brought up in our collab and, you know, sort of training session updates and stuff like that. I've got probably, I mean, we've got like 40 minutes, but we can finish early. I mean, I can tell you guys a story for 40 minutes if you want, but I just feel like that's a waste of our time. Excellent. Well, doesn't really seem like anybody has much to say today. It is a Friday, so we're all ready for the weekend. Oh, yes, Jazz.
I would just wanted to go back to Jehan Castaneda workshops, just to kind of explain a little bit about how they work, because I think I have been emailed from people to say, oh, when's the next Jehan workshop that I want to join? So the way that it works is that we are merely the collab, and Jehan, the partnership is the resource. So what the expectation is for a PH or any community organisation purchases his time and his workshop and our collaboration, if you like. So the way that it works is that he will come, we agree a date, but that organisation, that PHO, whoever hosts it, so they organise who's in the room, where the venue is, send the invites out, all of that. I have some flyers that I can share, so you just add in your details and stuff, but you manage all of that. So the organisation manages all of that, and there's just the transaction, the agreement between the two parties, between the host organisation and collab. Some networks have charged the community, so sometimes a little koha, because Jehan isn't, I mean, he is a award-winning journalist, storyteller, narrator, author, so he's not cheap. But if you think about the audience, so some networks have passed on a cost to people to attend, so to cover sometimes venue costs as well in catering, because it is a whole day kind of arrangement. So yeah. Sorry, you've got a question and you've got beautiful cat there.
Oh, this is my kitten, but as our plumber called
Kitten.
it, she's a horse. She's 5.6 kilos. You're just 9 months old, aren't you? Yes.
Wow,
She's going to be a big cat.
beautiful.
With his sessions, do you pay per number of people that you've got, or is it a flat fee?
It's a flat fee, and it is $7,000 at the moment. So, and with Wanganui, that, like I say, it was the largest group we had. There were 40 people in the room. So if you were to charge people a nominal fee, you know, you can bring that cost down. So, and as I say, what's been really exciting, where we have done it with a cross-sector representation. So we actually started in Kapiti. We had people from the health sector, from the social sector, from the council, and they all, and actually it was the council that kind of hosted it, because they said, hey, we've got a free venue, no charge, and they just kind of came together and provided a light lunch for people that came. So yeah, I mean, people kind of think, oh, that's a lot, but when you think about the number of people, so he could probably go up to about 45, I'd say. There were 40 on Wednesday, and it was a good size, wasn't it, Renee and Joe? It wasn't too big. Yeah.
Is that a whole day, Jazz?
Yeah, it's kind of 4 hours. We started
4
at like 10:30 and we finished at 2:30. So people could bookend with, you know, their other stuff. So people could do their meetings or, you know, emails in the morning and then emails after. We do try to condense it to limit the other costs like travel, because there is the additional. So if Jehan does have to travel, they'll, you know, we'd cover that for the team member as well. So there is a slight extra cost as well as his time. Yeah, and that's the idea, is just keeping it 4 hours, keeping it focused, and you could do some networking yourselves afterwards, before and after, so doing morning tea or some afternoon tea afterwards. You know, people sometimes like to do that as well. So yeah, but yeah, it is pretty full on though, one after the other, but still really good content as well. So yeah.
And so just I get, I mean, it's probably on the fly, but you get, is it so he tells in his book, he tells his story, right? And so is this workshop about how you would tell your own story, or okay.
Yeah, it's completely, I mean, he only shares a little bit of his own story. This is not about Jehan, this is about you.
Right, great.
This is about you as a leader and building your capacity and capability to be a good leader. So, yeah.
I mean, still, even if you had to on-charge people attending, I mean, $200 for 4 hours, that's cheap. You know, I mean, I'd pay
for
that.
a leadership course. Yeah.
You know, it's like, and you'd probably get more value out of that than what you might around, you know, I don't know, other stuff. So thank you.
Yeah. Awesome. Cool. Okay, back to you, Petrea, I guess.
I just want to mention one thing as well. I know it's in our newsletter, but we have got ProSci change management training coming up and Lean Kaizen training. We haven't got the final dates for those yet. So yeah, just keep an eye. I'll put it on the hub so I'll know who's actually using it. But yeah, keep an eye out, because we've had a great feedback for the facilitating change workshop, and yeah, some of these workshops are going to have limited seats, so it's good to get in early. So keep an eye out for those dates as well.
I had them at the bottom of my list, actually, Leanna. Thanks for reminding me.
That's all right.
I didn't scroll down far enough.
It's like a test, you know, who turns up to the training, who saw it on the engagement hub. We'll start putting competitions and prizes on there. Amazing. I think this was a really informative meeting. I'm looking forward to using the engagement hub myself. But unless anybody had anything else they wanted to sort of discuss, ask, bring up, I think we could probably wrap up. We've got that in an hour, which is good, you know, frees up half an hour for everybody to continue on with their excessively large workloads. So I will close up with a karakia, unless somebody else perhaps wanted to while we're here in the group. Let me pull mine up here. Where have I put it? I had it up before and then I moved it. Okay, so just closing karakia. I've got ko ranganui e tunei, ko papatua nuku e tuku nei, kia tau te rangi marie, ki ronga I tū tātou mahitahi, haumie, huie, taikie.
Taikie.
So just
Kia
thanks
ora,
everybody
thank
for
you.
coming. Wonderful to see you all. Have a great weekend and we'll see you next time.
Go the All Blacks.
Go the All Blacks.